Autistic children and adults have gifts that sometimes they are unable to enjoy because they are so tremendous that they blur a little bit their ability to see the rest of life and of events. So autism in itself can be the strength of the child or the adult once the pain of anxiety, of difficulty of sensory processing are resolved or attenuated. Communicating with adults on the spectrum is probably one of the most helpful things that we can do to start and understand that their world is very different in some aspects and very similar, but there is not a need to be in total conformity with the crowd. Everyone on the planet has a way of thinking. It comes from our education, our background, our culture, and people with autism are not different in that sense, that they grow with their own experience. We know that the brain develops from what we experience daily. A lot of people on the spectrum have a broader vision of the world, have a very intense desire to help. You can discover that easily simply by looking at interviews of adults who are on the spectrum and explain to us, this is how the world is for me, and this is what I would like to do for you. We need to understand that it is a treasure, and we do have something to learn. There is one particular thing that is typical of kids who suffer from depression, and unfortunately some of the children I've worked with suffer from depression. Young kids with depression will start being aggressive. Either they are going to hurt themselves or try to hurt other people. The judgment is very quick. We are just observing and we feel that person is upset with me or hates me. The reality is that this child is in pain and is asking for help in the way a child is asking. So we need to be patient and we need to accept the fact that everybody's different and will show emotions differently. It is extremely important that as many people as possible know about autism, so that the mom who goes to the supermarket and has the child have a sudden outburst doesn't feel embarrassed. It would be ideal to have other moms or the dads come and maybe sit by the kid and help this mother go through this moment. We need to share. We need to communicate, as we are trying to do with Mendability, that being different is not less, as Dr. Grandin says, and that if we are ignorant, we are at fault. We cannot be judgmental. We need to learn more, understand, and extend our hand towards the parent of a child with autism. Emotionally, my understanding is that the feelings are identical to our feelings, but probably how they show their emotion, their feeling, is very different. It seems to be that people on the spectrum have difficulty understanding people's facial expressions. They even have difficulties with recognizing people, the face features, because they may be born without the ability to imitate as easily. And we know that babies on the spectrum, babies with autism, do not look at their parents, which is one of the ways where that helps with learning about facial expression. In my experience, I believe that society is very restrictive, very judgmental, and those are flaws coming from ignorance. I have an experience where I'm shopping and there is an adult with autism. My experience helped me understand that situation. And while he is picking a shirt, he is very, very vocal. I can observe everybody else starting to go away and more away. And finally, this whole area of the store is empty, except for myself, the gentleman, and his aide. They finally discuss, well, the gentleman is not verbal, the aides ask, okay, is that the color you want? And then eventually they finish their shopping. So that situation for me was painful. I can imagine parents who love their kid and take the child to the swimming pool or to any public place of amusement, being embarrassed, feeling the eyes of the crowd on them with feelings of judgment. That is not a parent who knows how to discipline and raise this child. So this ignorance and this rigidity in our way of looking at adults or children with autism has to change. We must make it different. We need to realize that being vocal is something that a lot of people do, and the fact that we don't understand their words doesn't mean they're not saying something. So yes, we need to share what we know when we know, and definitely have maybe tell parents to turn around and say, well, my child has autism, it is difficult for him, but could you help me help him come up from the floor? Have this sort of generous sharing of space and time and situations, so that the parent who he is already exhausted and sometimes discouraged feel there is acceptance. This child will be happy when an adult in this society. I have an anecdote that will probably explain my thought here. It's about a little boy. He's 5 years old. He's nonverbal, and he's been taken by two helpers all the way to the bus stop. As they are walking, the two aides are discussing the fact that the grandfather of this kid died that morning, and they hope that things will be fine at home and that it will be not too difficult for him to understand what happened. Suddenly the child starts weeping, sobbing, and they did not make the relation that being nonverbal does not mean you don't understand. And all parents who have children who have difficulty with communication will tell you, kids understand. We need to be just attentive and respectful in the same way we are with people who do understand everything we say. So the advice is just be that way. Just be respectful, be careful, and do not assume that no word from the mouth means misunderstanding.